Hi, my name's Aylin. I'm a paediatric and adult anaesthetist working at the Children's Hospital and Austin Hospital in Melbourne. I'm here today with Dr Liz Crowe, who is a wellbeing specialist, academic and self-proclaimed disruptor. She has decades of experience in paediatric intensive care, expertise in crisis management, trauma, grief and end-of-life care. She's been front and centre of this ASM with amazing workshops on self-awareness at the ELC and professional grief at the plenary on day one. What wonderful opportunities for reflection. I have some questions for you. In fact, I could talk to you all day.
Okay.
What is the most surprising or moving insight you've gained through your work on grief?
Ooh. I don't know if I could isolate it to a single thing. I think the main thing for me is that there is no such thing as normal grief. And so just when you think you've seen the whole gamut or range of reactions to grief, something else will change. I'm recalling a time when we were working with a beautiful Maori family and it was all very quiet and the grandfather just started singing so loudly. It actually gave me a huge fright at the time. But I think, grief can be isolating and withdrawing. It can be expressive and creative. It can be illness. There's no end of it. And I guess, human beings are often different and interesting and exciting and odd and weird, and that is the same for grief.
Yeah, great, thank you. Thanks. I wonder how, obviously we as professionals, we can suffer through that in a professional and personal way. How do you think departments can help foster a culture of well-being?
In relation to loss and grief, or in general?
In general, but also potentially to do with professional grief as well.
Yeah. Look, our colleagues are the only people who will ever be able to have these proper, deep, in-depth conversations. It doesn't matter how much our family and friends love us, but there are certain things we will naturally want to shield them from, and there are things that they just can't understand about the work. And so you have to have these really connected relationships with your peers. And good culture in a department starts with every interaction every single day. And so I always say to people, culture starts with me, culture starts with you. And so if you and I are determined to demonstrate warmth, psychological safety, fun, and people see that, people are attracted to that, and then it builds on the way up. So it's got to come from every direction. But sometimes people are like, oh, our director is so serious, we're never going to be able to build a warm culture. Yes, you can. And sometimes people then decide this isn't the department for me, or, not everyone has to be involved. So I think once you've kind of got a culture where people feel included and feel safe, then it doesn't matter whether it's an error or it's a personal loss or it's something that's happened at work, then you'll be able to find at least someone who has really got your back.
Yeah, wow. Yeah, absolutely. Couldn't agree more. I'm really curious to know what, in that context then, we talk a lot about resilience.
Yeah.
What does resilience mean for you?
Good question. Look, to me, resilience, I think sometimes people are looking to get to this place in their lives or in their career where things don't hurt or where things bounce off you. And to me, that's being numb. That's the true definition of burnout. So resilience is about understanding that there's going to be times that are painful or fun or curious or, stretch you intellectually, and that you will kind of stay on your feet or you'll crawl into work. That still is resilience. It's not about not being impacted by things. It's about being impacted by things and being curious enough and brave enough and vulnerable enough to hang in there. And so anaesthetists are resilient. You couldn't have got ducks of your class. You couldn't have gotten through med school. You couldn't have gone through these fellowships if you weren't resilient. And so I think one of the main things for me with resilience is when something's really bothering me, instead of getting in my own head, stay really curious about it. Like, why is this particular incident really resonating for me, or why is this keeping me up at night, rather than pathologizing it, just saying I'm a human being and for some reason this has got in my head, and seek out help first with your peers. But if it's being prolonged, then think about seeing a professional.
Thank you so much. I mean, it kind of harks back to a point in your presentation at the plenary where you talk about having tears and crying along with someone. I think that's really, really powerful. It just means that you're human. So
yeah,
I couldn't agree more with that as well.
And to me, sitting in the rubble is like you slide down the floor and sit there, and then I just sit beside you, and I might even say, I'm not sure what to say. I'm here, buddy.
Yeah.
That's it. That's what it looks like. That is support.
Yeah, absolutely. Thank you so much. Thanks for your time today.
No worries.